All right, everybody. Good morning, good afternoon, good evening. This is Dr. Kaz, and I am bringing you another fun-filled episode of Education, Learning, and Wonderment. We are going to continue on with the reproductive system. And so we're going to pick up where we left off in talking about the male reproductive system. And so we are going to discuss now the hormonal regulation when it comes to the formation of sperm, the process of spermatogenesis. So very similar to what we learned about in the female reproductive tract, all right? Similar type of scenario is going to occur. We're going to start obviously with the master gland here, the hypothalamus. The hypothalamus will release, all right, one of its regulatory hormones, gonadotropin releasing hormone, which will then stimulate the anterior or adenohypophysis to release and secrete, all right, our follicle stimulating hormone and our luteinizing hormone. Okay, so the luteinizing hormone, all right, is going to stimulate, all right, the interstitial cells. We learned that these are the cells that are going to produce our testosterone. Okay, we'll talk about the many effects of testosterone in a moment, right? But it's the luteinizing hormone that stimulates the interstitial cells to secrete testosterone. Meanwhile, our follicle stimulating hormone, okay, is going to stimulate the sustentacular cells, okay, to secrete what we call androgen binding protein. And it's this protein that is going to allow an increase in level of testosterone, all right, to be present in the testicles. And this will help us in the production of our sperm. So we'll see with testosterone, it is going to facilitate, all right, spermatogenesis, the formation of sperm. Okay. Now, don't forget, we are going to be dealing with our negative feedback system here. So while we're getting an increased amount of testosterone, all right, that increased amount of testosterone is going to cause the hypothalamus, all right, to decrease, or we're going to inhibit the release of gonadotropin releasing hormone, thereby, all right, decreasing the anterior pituitary, all right, from releasing follicle stimulating hormone, all right, and our luteinizing hormone. Okay, so this will produce a negative feedback effect, right? Because again, we don't want to produce too much sperm, okay? So this helps to regulate the amount of sperm that we are producing. Meanwhile, we've got our sustentacular cells. These guys are the troops on the ground, the local group there that are going to be responding to how much sperm is being produced. Right, so we have high levels of testosterone that are going to actually affect our sperm number, but also, right, as the sperm levels increase, right, the sustentacular cells will release inhibin, okay, and that inhibin will also cause a decrease or an inhibition of follicle stimulating hormone to be secreted from the anterior pituitary. Again, we're going to deal with that negative feedback mechanism going on there. So we're not producing too much sperm, okay? So you can kind of see these results here. And finally, all right, the effects of testosterone, all right, are going to A, determine your sex drive or libido, all right, but also it'll help with the determination of what we refer to as secondary sex characteristics. And in males, that is the deepening of the voice, right? Because we are thickening the vocal cords, right? They'll start to develop facial hair, all right? And also they'll get secondary hair growth around the armpits, the axillary regions, and then the pubic regions there also. And also they'll start to increase skeletal muscle mass. So testosterone does play a large role in the development of these secondary sexual characteristics here. All right, so you can see here on our graph this feedback system. Okay, so we can see how, all right, initially we have our hypothalamus producing the gonadotropin releasing hormone. We saw this in chapter 17 in the endocrine system, and that gonadotropin releasing hormone will stimulate the anterior pituitary to release its follicle stimulating hormone and the luteinizing hormone. All right, so the follicle stimulating hormone, all right, is going to stimulate our sustentacular cells here to secrete that androgen binding protein, which will help to increase our testosterone levels. All right, but when we see an increase in the testosterone levels, right, that's going to cause an inhibition of the gonadotropin releasing hormone. All right, so we're going to get that negative feedback mechanism to occur. All right, so we can decrease the anterior pituitary secretion of its hormones there. Whereas testosterone, like I said, is going to contribute to sex drive, libido, right, and the secondary sexual characteristics there. All right. Meanwhile, we're going to see now, all right, in our luteinizing hormone here, all right, we're going to get an increase in production, all right, of the interstitial cells here, all right, and those interstitial cells will also produce testosterone, all right, contributing to that negative feedback system also. Okay, but what we'll see now is because of that follicle stimulating hormone, the production of sperm. All right, spermatogenesis is going to be in full swing in its production. Okay, so our sperm levels will increase. All right, but our sustentacular cells will be monitoring the amount of sperm that's going to be present, and when those levels get to a high count, then the sustentacular cells will release inhibin, and it too will then also have that negative feedback effect on the hypothalamus and the anterior pituitary. Okay, so we can see it's a nice little system that we have going on. Okay, it helps to keep sperm count in check. All right, so you're not producing too much. So let's now talk about spermatogenesis. All right, so when we get to talking about spermatogenesis, there's two parts to it. All right, so we actually have the spermatogenesis, and we will produce our secondary spermatocytes, which will eventually then give rise to spermatotids, which will then eventually give rise to sperm cells. All right. And when we talk about a spermatotid differentiating into a sperm cell, we call that spermiogenesis. Okay, so let's talk about first spermatogenesis. Okay, so this is going to occur in our seminiferous tubules. Okay, and it'll start in the periphery of the seminiferous tubules, so on the outer edges there. All right, this process begins in puberty. Okay, for males, doesn't happen when they're a fetus. All right, doesn't occur during pregnancy when mom is pregnant with the male fetus. All right, doesn't start like that when we were similar to when we were talking about oogenesis. All right, this process begins in puberty. So nothing, men are pretty boring. Nothing really happens, all right, until we get to puberty here. And at that point, then we will start to secrete the follicular stimulating hormone, FSH, and luteinizing hormone, LH. Okay, so we're going to have our primordial germ cells. We call those spermatogonia. Okay, and again, they're at the periphery of the seminiferous tubule here. The spermatogonia are diploid cells. What does that mean? That means they have 46 chromosomes or 23 pairs of chromosomes here. All right. So these cells, all right, are going to then differentiate, all right, through, I shouldn't say differentiate, but these cells are going to undergo mitosis, not meiosis, but mitosis. All right. And so we'll get a new spermatogonium cell, which is our primordial germ cell, but we'll also get, as a result of mitosis, a primary spermatocyte. And it's the primary spermatocyte which will start to undergo meiosis. Right? And then that's when we're going to wind up with haploid cells. And we'll talk about that in a moment. Okay? But keep in mind, all right, spermatogonia are these primordial germ cells, all right, kind of like those primordial cells that we saw, all right, in the ovary, all right. It's from these cells that our sperm is going to come from, all right. They are diploid cells, all right, and they're on the periphery of the seminiferous tubule. And so they're going to undergo mitosis. And from that mitosis, we'll get more spermatogonium, all right, more primordial germ cells, but we'll also get our primary spermatocytes. And those primary spermatocytes are going to undergo meiosis. Oh, fun meiosis. Okay? Those are going to be diploid cells. So these primary spermatocytes will start to undergo meiosis. All right? And then we'll wind up, all right, at the end of meiosis 1 with our secondary spermatocytes. Now, this all occurs in puberty. Okay, so where we had one cell, the primary spermatocyte, at the end of meiosis 1, we'll have 2 cells. Okay, we call those secondary spermatocytes. These are, make a note of this, haploid cells. So we started off with 46 chromosomes in a primary spermatocyte. Okay, it's a diploid cell. Then it undergoes meiosis 1, and we wind up with 2 cells. And now each of these cells are haploid cells, which means they only have 23 chromosomes. All right, but now we go from the periphery of the seminiferous tubule. Now we're working more towards the center. We're moving towards the lumen. Okay, we're edging closer, ever so closer. Okay, so now our secondary spermatocytes are going to then advance onto meiosis 2. And at the end of meiosis 2, all right, we're going to wind up with spermatids. So our secondary spermatocytes, each haploid, all right, are each going to produce 2 spermatids. Again, those spermatids will be haploid. Okay? And so they'll be even closer to the lumen of our seminiferous tubule. And our spermatids are going to start to take on, all right, a shape similar to the sperm. The final, they'll undergo, all right, spermiogenesis, and they'll start to take on a shape similar to an actual sperm cell. We'll talk about that in a second here. All right, but a spermatid, when it's first formed, is still going to look like a circular cell. Okay, but then it's going to undergo spermiogenesis, and then it'll look more like a mature sperm cell, all right, which we'll talk about here in a moment. All right, so the last part of spermatogenesis is where we have those spermatid. Now we have 4 spermatid cells, all right, all haploid, are going to start to get their tails and get their head and have flagella, okay? So we're going to advance, all right, to our final sperm stage, which is called spermatozoa or sperm. Okay. So what we're going to see is the nucleus, all right, is going to be in the head of the cell, all right, not in the head of the cell, but it's going to start to take a different shape change there, all right, and we're going to get rid of a lot of the cytoplasm. All right, so we're going to start to see some distinctive features on our cell. The first one is called the chromosome cap. All right, the important characteristic of the chromosome cap that I want you to know is this right here, loaded with these digestive enzymes that are essentially, if this sperm is lucky enough to have traversed the female reproductive tract and made it up into the fallopian tubes, into the ampulla of the fallopian tubes, and it's lucky enough to meet up with its secondary oocytes, all right, that secondary oocyte is surrounded, all right, by, for lack of a better term, like a shield, a protective covering. And so this sperm has to burrow its way through, all right, the protective covering, the zona pellucida and the corona radiata of this secondary oocyte. So it's still got to work. It's worked its way all the way up into the female reproductive tract. It's still got some more work to do. So that chromosome cap is going to burrow itself through there with the aid of these digestive enzymes. And what's going to help it propel it there is the tail. And our tail is a flagellum. It's the only cell in the human body that has a flagellum on it. All right, the sperm is. All right, and basically what makes up the tail are all these microtubules that you learned about in chapter 4. Okay, and in there, all right, in that sperm cell, you'll have this centerpiece, this midpiece here, that's going to contain tons of mitochondria. We know what the job of mitochondria is. It's the powerhouse of the cell. It's to produce ATP. That ATP is going to function as the energy source in which to operate that flagellum, that tail, all right, to move that sperm cell to that secondary oocyte. And that's what we're going to deal with here. All right, so a couple differences between males and females, all right, when we talk about gametogenesis, which is spermatogenesis in males and oogenesis in females, okay? First one is when we're dealing with oocytes in sperm, okay, at the end of oogenesis, all right, in females, we only have one single cell, secondary oocyte. In males, we're going to wind up with 4 sperm cells, okay? 4 sperm cells or spermatozoa, all right? So that's one difference, okay? Another difference is in females, okay, meiosis starts before the female is born, okay? So even before that female is born, right, they've started meiosis and it stops in prophase 1, okay, the beginning of meiosis. But still, this happens prior to birth. Again, in males, nothing exciting happens until puberty, okay? And then finally, all right, when we're dealing with differences between, all right, males and females in regards to gametogenesis, is females can only reproduce up until menopause, all right? Whereas males can pretty much reproduce throughout their life. So you can still have men in their 80s, 90s, all right, if they're able to have intercourse, all right, they could potentially and possibly have children, all right? So unfortunately with women, because of menopause, right, they will not be able to be producing viable oocytes. All right, so let's take a quick picture here just to kind of review what I was just discussing. All right, here we're looking, all right, with spermatogenesis here. All right, on the periphery of, here's our seminiferous tubule, here's the lumen in the center, the periphery on the outside here. This is what we're dealing with in the beginning. The spermatogonium, diploid cell that can undergo mitosis, all right, which it can produce another spermatogonia, and it can also produce a primary oocyte, or excuse me, primary spermatocyte. So that primary spermatocyte now, at the beginning of puberty, or not the beginning, but during puberty, right, will now undergo meiosis 1. And at the end of meiosis 1, we have 2 daughter cells, all right, which we call secondary spermatocytes, and they're haploid, 23 chromosomes each. Okay? Then we undergo meiosis 2, and at the end of meiosis 2, we now have a total of 4 spermatids, and they are all haploid. All right, so now spermatids are going to undergo spermiogenesis, in which the spermatids are going to start to develop into spermatozoa or sperm cells. So we'll kind of see that in a moment here over to our right. But you can see as it undergoes, then we'll wind up with our sperm cells here. Okay, so that whole process is called spermatogenesis. Now from this part here down, all right, that's spermiogenesis, and that's what we're going to see here. All right, Here's our spermatid. All right, it's going to start to develop the chromosome cap. All right, and you can see the cytoplasm is going to start to become less and less. All right, and at the same time, now we're starting to develop our flagellum. All right, and that process occurs during spermiogenesis here, and we can see at the end of spermiogenesis, now we have, all right, what looks to be like our final product of sperm, where it has its head with the chromosome cap, and then we have this midsection here, all right, where you can see we have tons of mitochondria to operate this long flagellum, the long tail. Okay, and so that is going to be the spermiogenesis portion of spermatogenesis. Okay, the development of a spermatid into a sperm. And again, as we are doing this process, we are working from the periphery down towards the lumen here, and in the lumen, that's where you're going to find your sperm of the seminiferous tubule. And then we have to do some other things, which I'm going to talk about. Okay, let us discuss the accessory glands and semen production. All right, so accessory glands in the male reproductive tract are going to be, all right, seminiferous tubules and our prostate gland, and then we also have like the Cowper's gland, some other glands here. All right, but ideally, when we are producing sperm, we have to give them an environment that is suitable to maintain, all right, their viability. And so that is where semen comes into play. Okay, semen is made up of the seminal fluid, all right, and the sperm. So semen, when it is released from the male during intercourse, we refer to it as ejaculate. And inside that semen, you can see anywhere from 200 to 500 million sperm cells or spermatozoa. That is huge. But all things considering, all right, that journey, all right, through the female reproductive tract, all right, the majority of those sperm are not going to make it to their final destination. Okay? So what we'll see here is, all right, a large number of sperm being released, but the likelihood, because one, there's a lot of factors that play a role in fertilization. One is timing. All right, the secondary oocyte is only viable for 24 hours. Now, luckily, sperm can live up to 3 to 4 days, all right, outside of the male, which is good, but we only have a 24-hour window. Okay, so those 200 to 500 million spermatozoa, all right, don't have a very, I shouldn't say good, but a great likelihood of success. All right, so let's talk about the duct system here. All right, so going back now to, let's see if I can find it. There we go. Well, that's not the one I wanted. All right, going back to one I wanted. Our duct system, I've talked about here before. All right, so we're starting off here in our lobules with the seminiferous tubules. Now we have to get those sperm, all right, the spermatozoa from the seminiferous tubules, all right, into the mediastinum testes, specifically the ret testes. And the ret testes are just this tubular network that drains all these lobules and eventually into, all right, our epididymis. Because here, this epididymis, this comma-shaped structure that sits on top of the testicle, is where the sperm are going to go to mature. Okay, we're going to start to get them ready, all right, for ejaculate for intercourse. Okay, but an immature sperm is no use to us. All right, so we need to take them to a place here where they can hang out for a little bit and undergo the maturation process. All right, so that's what we're going to see, the drainage from our seminiferous tubules into the ret testes, and then eventually from the ret testes, they'll enter into, all right, our epididymis, all right, through what we call the efferent ductules. And then from the epididymis, all right, they'll leave the epididymis, move into our ductus deferens or vas deferens, then eventually up into the spermatocord, into the abdomen there. and the pelvis. So we'll get to that in a second. All right. So that was a quick review there. So let's talk about what we're discussing here. All right, our ret testes, all right, are where the sperm, all right, are going to enter into before they move into the epididymis here. Okay, so the ret testes are going to receive the sperm from the seminiferous tubules. All right, and it's basically in the ret testes here, all right, where we're going to get the absorption of any type of fluid that isn't necessary for the sperm's development into the epididymis here. So the lining of these structures are going to be a simple cuboidal epithelium. And as you recall, simple epithelium is great for secretion, filtration, and absorption. So we're going to be using, all right, the ret testes here, all right, to kind of rid ourselves of any excessive fluid or whatnot that isn't vital to the sperm here. So the sperm move into the ret testes, and then from the ret testes, they move into the epididymis through the efferent ductules here. Now the efferent ductules are lined with ciliated columnar epithelium. Keep in mind that sperm are not motile, all right? They cannot move on their own. Those flagella are not working yet, so they need help. The only time that those flagella, all right, are going to be useful in the mobility of the sperm is going to be when the sperm exit the male, all right, during the ejaculation phase. Okay, so up until that point, they need help with getting from point A to point B. So we're going to help them. We have our ciliated columnar epithelium that are going to move, all right, the sperm from the ret testes into the epididymis. And that's where we're going to see, all right, the sperm moving with the help of the ciliated columnar epithelium. Also, we have non-ciliated columnar epithelium, all right, to continue to absorb any excess fluid there, all right? And from there, we drain into the epididymis. So in the epididymis here, this is where our sperm are going to spend a little bit of time, like at a spa or a resort. And here they're going to start to mature and get ready, all right, for exit from the male body. Okay. So in this area here, all right, we are going to see a couple different areas: the head, the body, and the tail. Just think of it like that comma structure that I mentioned before here. All right, and then at the base, or at the bottom of the epididymis, is where we have the duct of the epididymis, which is going to then allow the sperm, all right, to move from the epididymis into our ductus deferens, or the vas deferens here. All right, and that area is lined by pseudostratified columnar epithelium, but importantly, more cilia, stereocilia, which will then again help to move the sperm from the epididymis into the vas deferens, all right, or the ductus deferens there. Okay. All right. So like I said, here in the epididymis, this is where the sperm are going to mature. All right. They spend some time here. All right. So of course, any sperm that stays there too long is just going to be resorbed. Okay. So old sperm gets resorbed. All right. And sometimes there's a situation in which sperm are not mature enough. All right. They get expelled. Doesn't matter, they're not motile. Most likely, those sperm are going to be useless in the fertilization of an oocyte. Okay. So now we move from the epididymis into our vas deferens, or ductus deferens. Okay. Again, this structure is going to reside within the spermatic cord, and from the testicles up through the spermatic cord, it will enter into, all right, the peritoneum, all right, through the inguinal canal. That's that canal that sits in the crease of the leg, where you bend your hip there, and that crease where your lower extremity meets the pelvis there, all right, that crease there, that's where the inguinal canal resides. There's an opening there. okay? And it allows the spermatic cord to enter into the pelvic cavity. And so it'll then run across the top portion of the superior lateral surface of the urinary bladder. And it'll run around to the back, to the posterior portion there, all right, in which it will then enter into the prostate gland. All right, it will meet up, all right, with the seminal vesicle there, because there's a little duct there from the seminal vesicle, all right, to allow, all right, the seminal fluid to enter into the prostate gland along with, all right, the sperm. This is where we get that mixing of the sperm, all right, and the seminal fluid to form semen. Okay, and where that occurs is when we have that union of the ductus deferens, all right, with the seminal vesicle opening there. That's where we have the ejaculatory duct. Okay. So how does the sperm move? All right, through the ductus deferens or the vas deferens. All right, it has help. All right, not only does it have help from the epithelium, all right, because there's cilia along there, it also gets help from, all right, muscle cells. So we know that most of these areas here have 3 layers, all right, like the female reproductive tract, the male reproductive tract has 3 layers, right? So when we're talking about the ductus deferens, the innermost layer, we refer to that as the mucosa, and that is lined with the pseudostratified ciliated columnar epithelium. Again, the cilia will assist the movement of the sperm, all right, towards, all right, the prostate gland there. And then the middle layer, the muscularis layer, has 3 layers. Notice there are 3 layers here, okay? And those 3 layers are going to assist in moving the sperm throughout the ductus deferens. Again, they're still not motile, so they can't get to where they need to go unless they have help. Then the outer layer is the adventitia. Okay, so the sperm now have made it up, all right, into the body. They're on their way, all right, towards the prostate gland. All right, here they make it to the ejaculatory duct. Again, ciliated epithelium there, all right, which will allow the movement of that sperm, okay, into, all right, the prostatic urethra there, okay, as it mixes with the seminal fluid. All right, and then from there, we know what happens. All right, the semen then moves from the prostatic urethra through the membranous urethra, and then eventually into the spongy urethra, all right, in the penis there, and then out of the male, all right, during the ejaculatory phase of intercourse, okay? So from the ejaculatory ducts, we have to go through the 3 parts of the urethra, okay? Prostatic urethra, the membranous urethra, and the spongy urethra. So in this picture here, you can see, all right, from start to finish, how it works with our sperm. Seminiferous tubule development of the sperm, all right, moves into the epididymis for maturation, and then once it's time to leave, then it travels up through the vas deferens along the superior lateral portion of the urinary bladder, down to the posterior portion of the urinary bladder, all right, where it meets up with the seminal vesicle here, all right, and then the ductus deferens and the seminal vesicles, all right, will produce or secrete or release, all right, their components into the ejaculatory duct here in the prostate. And then from there, all right, the semen will enter into the prostatic urethra, travel through the membranous urethra, and then out through the spongy urethra, all right, to leave the male body. Okay, so let's finish up with the male reproductive system like we did with the female reproductive system and talk about the male sexual response. Okay, a couple different phases. The initial phase, the first phase of the male sexual response is the excitement phase, similar to the female excitement phase. We get engorged tissues with blood that will cause erection of the tissues, all right, an obvious erection of the male penis here, all right, but it is due to the venous spaces being filled, all right, with blood. Now here's the thing, okay? You have the artery here that is going to become engorged and increase in flow in blood, all right, due to the autonomic nervous system here, all right? So during the excitement phase here, the blood fills these spaces, all right? And so the structures, mainly the penis, becomes rigid and erect. Now at the same time, all right, as we know, blood comes into the tissue and veins usually drain the tissue, all right? But because of the amount of blood that comes in, it compresses the veins. So it briefly will prevent blood from leaving, all right, the venous spaces, which is good because that helps to sustain an erection here, okay? The blood will only leave once the excitement phase is over, all right? So in addition to that, the parasympathetic division of the autonomic nervous system is going to help to release nitric oxide. That's great. Nitric oxide, all right, is a vasodilator, okay? So it causes an increased amount of blood flow into those tissues, hence erection of the penis, all right? Now, while this is going on, the sympathetic nervous system is stimulated to increase heart rate, blood pressure, and respiration. Okay, so we're seeing both divisions of the autonomic nervous system play a role in this. But if you remember, all right, when we were talking about the autonomic nervous system, all right, you have what's called the cooperative effect. So both divisions will play a role in the eventual outcome of a physiological response to something. Well, when it comes to intercourse, all right, for the males, you have the parasympathetic nervous system, which plays a role in the excitement erectile phase of the penis. So we say point, all right, point for parasympathetic, all right, and then we say shoot for the sympathetic because during the ejaculatory phase, all right, or when an orgasm occurs, all right, it's the sympathetic nervous system that promotes the ejaculation and the release of the semen from the male. And so the next part is the orgasm, all right? And same thing that we saw in the female happens in the male, except, all right, in the male we have expulsion of the semen. So we'll see intense pleasure, all right, you'll have a tension release where it builds up, all right, and then the sympathetic nervous system kicks in and it causes the expulsion of the semen, all right, from, all right, our ductus deferens, all right, out towards the urethra here. And so pretty much what I was saying earlier, all right, we're going to have the involvement of our accessory glands, all right, we'll see the seminiferal vesicles here, all right, producing that seminal fluid to help produce semen. So as the sperm and the seminal fluid combined, they form the semen, and that semen is released, all right, during the orgasm phase here. Meanwhile, all right, while that's occurring, all right, the internal urethral sphincter at the base of the urinary bladder is contracted significantly for obvious reasons, all right? We do not want urine, all right, to also enter into this equation because amongst the many issues, depending on what the contents of the urine are, we just don't want urine to enter into this. At the end of the orgasm is the ejaculation, in which the semen is expelled, all right, from the male, all right, with the contractions of the muscles throughout the urethra, okay? And it's all thanks to sympathetic innervation. Shoot, point and shoot. The final phase is the resolution phase. This follows orgasm, in which we have intense relaxation, all right? And because of that, now the only thing that can affect, all right, our blood flows has always been the sympathetic division, all right? So what happens is the sympathetic division now is going to be stimulated all right, to increase the release of its neurotransmitter onto the blood vessels there, which will cause vasoconstriction, all right, which will cause contraction of that central artery of the penis. And what will happen then, because we're causing that vasoconstriction and that contraction, decreased blood, all right, and decreased blood will enter into those erectile tissues. What will happen then is we'll expel all that blood, all right, in those tissues, and the penis will now go soft and flaccid. And then the final part of the male sexual response is the refractory period, all right? And then during this period, no erection is possible, all right? Unfortunately, all right, when you compare this to male and female refractory periods, all right, I talked about how the refractory period for female, all right, they can have multiple orgasms. Unfortunately, with men, all right, during the refractory period, all right, they cannot have an erection. All right, so it will take a while. Depends on usually the age of whoever we're talking about here. Younger folks have a shorter refractory period, whereas older folks have a longer refractory period. Okay. All right. Last part here, when we're talking about, all right, males and the climacteric portion here, we will see as men get older, they'll have an overall decrease, all right, in testosterone levels, all right, in part by a decrease in interstitial cells that produce the testosterone, all right. So we'll see more of a gradual decline in men, all right, whereas with women, all right, when they hit menopause, there's a significant decline in their hormones. Men, it's more gradual, okay? So for the most part, all right, we're looking at the symptoms here, or when we talk about men and their decreased testosterone levels, all right, we'll see mood swings, definitely a decrease in sex drive. Don't really see the hot flashes too much, but it is a symptom, okay? Part of it too, as men get older, they get prostate enlargement, all right, the condition's called benign prostate hypertrophy. All right, and that can also impact upon sexual function. We'll also see it in urinary functions because when they get prostate enlargement, it can squeeze on the prostatic urethra there and make it more difficult to empty the bladder completely, but also they can have difficulty initiating the stream. Several issues with that. And of course, as men get older, there's always the possibility of erectile dysfunction and impotence, all right? But of course, we've got drugs to help with that. But when we talk about erectile dysfunctions, all right, they can have an issue in trying to achieve or even maintain an erection, okay? Again, as they get older, that's a more likely type of scenario or situation for them to be in. All right, well, that concludes, all right, our reproductive system. I hope you find this video helpful. Of course, if you have any questions, you know what to do. All right, that being said, I hope everybody has a wonderful day.